when we talk about vaccines, we always think vaccines it's only for children. It's not like that. Vaccines are becoming increasingly common and necessary for adults also. Instead of I mentioned about DPT, the diphtheria the antigenic component in the diphtheria is more, whereas in Tdap it's tetanus and a lesser amount of diphtheria and pertussis antigen. So from 2012 onwards, the pregnant women has been advised to get Tdap injection during each pregnancy, so we can offer some protection to the baby when the baby is born. And that vaccine is usually given between 27 to 36 weeks of gestation. And influenza these days we offer for most adults, and especially if they are asthmatics or underlying chronic lung disease or COPD, all those patients do get influenza shots regularly. And other vaccines which is advised for adults is MMR and chickenpox if they have not had the disease as an adult, and also for human papillomavirus for people up to 48 years of age. And shingles vaccine also adults 50 and older, it's been advised. Pneumococcal vaccine, especially in diabetics or elderly people 65 and older, do get pneumococcal vaccine. And now we know that the 2020 we have COVID-19 also included. So what are the trials like other infections? What we are waiting eagerly to get vaccines is this Group B streptococci. Group B streptococci is a real killer. If mother in Western countries, especially mothers, if they are colonized, they can be really detrimental to the newborn baby. So lots of trials are going on to give injection to the pregnant mother, like how we are doing Tdap at the moment. So thereby passing immunity or antibodies to the baby via placenta. So that's still ongoing research. Another infection which we really look for vaccine is that RSV virus, respiratory syncytial virus. This is particularly very common in preterm babies ending up in bronchiolitis, or babies who have spent almost 2 months in NICU, outgrow that prematurity, go home happily and come back and get admitted and reventilated with this bronchiolitis. So for this particularly, currently in Western countries, they do use immunoglobulins as soon as the baby is monoclonal antibody they use. If once the baby is preterm, going home, risk of infections, the seasonal time, they would give monoclonal antibodies to the baby so that they can protect them from the RSV virus. And the other virus which we are talking about is the cytomegalovirus, because cytomegalovirus it causes significant hearing loss in the newborn baby. If it is identified, not only hearing loss, it causes lots of other CNS issues, or it can cause liver disease, severe jaundice, liver failure. All these things can happen with the congenitally acquired cytomegalovirus. So lots of research going on about vaccination for this virus. Other thing which we would be really happy to have vaccines for is our NICUs, or small infants who get antibiotic resistant gram positive bacteria, that is especially for Staph aureus, and gram negatives like Klebsiella and Pseudomonas. And I mentioned about this, whatever the clinical trials before the vaccine safety is confirmed and they come into market for public use, it almost takes about 10 years. But we all understood that it doesn't need to be the same long procedure. With the COVID pandemic, we all understood that the vaccine technology can improve and we can get the vaccines as soon as possible.